In this video, we're going to be discussing the test item cluster for AC joint pathology. The AC joint test item cluster consists of three special tests. The first is the cross-body ADDuction test. The second is the AC resisted extension test. And the third is the active compression test. And some of these go by alternate names that we will see throughout the video. Now, when you have multiple positive tests within this cluster, that normally suggests either AC joint osteoarthritis or a ligamentous injury to the AC joint. And that could either be a simple ligament sprain, so a type 1 or 2 AC joint sprain, or complete joint separation to some extent, and that would be types 3 through 6 AC joint injuries. Now, speaking of positive tests, each one of these three special tests that we're going to look at in just a minute has an individual sensitivity and an individual specificity. However, if we consider the entire test item cluster, there is a pooled sensitivity and a pooled specificity based on how many of the three tests are positive. If we consider the case where any one of the three tests is positive, so 1 out of 3, the sensitivity is actually 0, it's terrible, and the specificity is not very good, it's 74%. However, if we add an extra positive test, so 2 of the 3 are positive, now the sensitivity shoots up to 81% and the specificity is up to 89%. That's pretty good. With all three of these tests being positive, the sensitivity actually drops to 25%, but now you have an excellent specificity of 97%. In other words, if you have a patient that tests positive for all three of these special tests, there's a 97% chance that they actually do have an AC joint pathology, which is pretty darn good. Now let's take a look at each individual special test. The first test is called the cross-body adduction or ADDuction test, which is also known as the scarf test because if we look at the final patient position, it's almost as if you're wrapping their arm around them like you would a scarf. The patient can be positioned either in seated or standing. I'm doing it with the patient in seated, as I am for all three of these tests later on. Initially, the PT is going to bring the patient's shoulder into 90 degrees of flexion, as you see right here, and then once at 90 degrees of shoulder flexion, the PT is then going to bring the shoulder into maximum horizontal ADDuction like you see right here, almost as if you're wrapping the arm around them like you would a scarf. A positive test would be reproduction of familiar pain atop the shoulder near the AC joint on the ipsilateral or test side. And it's very important for all three of these AC joint special tests that the pain be right on or very close to the AC joint, because if it's not, that may indicate that the pain generator is somewhere else, not the AC joint. And the reason that this test position provokes this familiar AC joint pain is because it causes compression of the medial acromial facet against the distal clavicle. As a standalone test, the psychometrics are not that great. The specificity is only 79%, and depending on who evaluated it, the sensitivity ranged from 77% to 100%. Let's watch this one more time. So first, bring the patient's shoulder into 90 degrees of flexion and then proceed to move it into maximal horizontal ADDuction. That is the test position. The second test here is the AC resisted extension test. This name is a little bit of a misnomer because the patient is not actually doing shoulder extension. They're actually going to be trying to do horizontal abduction, which you'll see in just a minute. The patient can either be seated or standing, and initially, the PT is going to bring the patient's shoulder into 90 degrees of flexion with the elbow also at 90 degrees of flexion, as you see right here. And then the patient's going to attempt to horizontally abduct their shoulder against the PT resistance. So I'm going to try to be pushing her arm in this way. She's going to try to push her arm out towards me. Let's take a look at that. So from this position, I apply a resistance into horizontal ADDuction. She attempts to horizontally abduct. And a positive test is going to be reproduction of familiar pain atop the shoulder near the AC joint, just as it was in the cross-body ADDuction test before. As a standalone test, the psychometrics are still not that great. The sensitivity is 72%, while the specificity a little bit better at 85%. Let's take a look at this test one more time. So we bring the patient's shoulder into 90 degrees of flexion with the elbow at 90 degrees of flexion, and then I'm going to try to push her into horizontal ADDuction while she pushes against me into horizontal ABduction. The third special test is the active compression test, also known as O'Brien's test. This test is a little bit different than the previous two because although it can still be used to rule up an AC joint pathology, depending on the result, it may also indicate a labral tear within the shoulder joint. This test is going to be done with the patient either in seated or standing, and it's done in two parts or positions. For part one, the patient's going to hold their shoulder in 90 degrees of flexion with the elbow straight. Very important is that the thumb points downward with the palm facing out laterally. You may have to demonstrate this or even help the patient into this position if they don't understand it. Once they have this position, you're also going to position their shoulder in about 10 to 20 degrees of shoulder horizontal ADDuction. So that just means moving their shoulder in a little bit like this. And from here, you as the PT are going to apply a force downward, and the patient's going to actively resist and try to maintain that test position. So that is part one or position one. Position two is almost identical except for the fact that the palm faces up. So you can see here, shoulders in 90 degrees of flexion, 10 to 20 degrees of horizontal ADDuction, because I pushed it in a little bit. Elbow is straight, and now the palm is facing up. And you do the same thing. The PT is going to apply a downward force. The patient's going to actively resist and try to hold the test position. So the only difference between these two test positions is in the first, the thumb pointed down with the palm facing out laterally. Here, the palm is facing up. A positive test here is going to be reproduction of familiar pain atop the shoulder near the AC joint, but only in position or part one, like you see right here, where the thumb is facing down and the palm is facing outward. There should be no pain provocation in part two for this to be a positive test, so only pain in part one, or position one. Also, the depth of the pain gives you some important information. If it's truly an AC joint injury, the patient's going to indicate that the pain is felt more superficially. But if the pain is very deep within the shoulder joint, it's probably more indicative of a labral tear. As a standalone test, the psychometrics vary greatly depending on whether you think it's an AC joint injury or a labral tear. And again, you can differentiate those based on the depth of the pain that the patient reports. Now for an AC joint injury, the sensitivity ranges greatly depending on who evaluated it. It's as low as 41%, which is terrible, all the way up to 100%, which is excellent. In contrast, the specificity has a really narrow range from 95 to 97%. So as a standalone test, the specificity regardless is excellent for the active compression test. Now for a labral tear, the sensitivity ranges from 63% to 100%. Pretty broad range there, and the specificity ranges from 73% to 98%. If you suspect that this is a labral tear, then there's other special tests you can use to rule up or rule down a labral tear. If you think this is an AC joint pathology, you're probably going to look more at the pooled specificity and sensitivities that we saw at the beginning of the video for the test item cluster. Let's take one more look at this special test. So for part one, you're going to position the patient's shoulder in 90 degrees of flexion with the elbow straight, thumb facing down, palm facing out, and 10 to 20 degrees of horizontal ADDuction. Apply a downward force and the patient resists. For a positive test, only this position would provoke that pain atop the AC joint. For part two, the patient position is almost identical except now the palm is face up. 90 degrees flexion, elbow straight, 10 to 20 degrees of horizontal ADDuction, and the PT is going to apply a downward force that the patient resists. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.